forward to it.
Normally, we do this segment on Thursday mornings out of our 8:30 news, but you know what? Sometimes we just get so darn excited and want to do it a day earlier that we just decided we would.
It's shocking that doctors have plans sometimes.
Right. The segment is called What's Up, Doc, where we spend some time with the experts in healthcare from Mercy Health, and this morning is absolutely no exception to that. We're going to learn about the topic of stroke, what you need to know, and a lot more about it with Dr. Bansal. And, well, he's someone who knows his way around this particular topic. Dr. Bansal, good morning to you.
Good morning to you.
Thanks for taking time to be on with us.
My pleasure.
Tell us a little bit about you.
So I've been at Rockford at Mercy Health for about 3.5 years now. I live here in Rockford. I grew up in Kentucky, actually, and I trained in Cincinnati and did some advanced training in Chicago and Michigan.
You got here via Kentucky and Ohio. How'd you end up here in Rockford? Did schooling bring you this way?
Training, and then I kind of fell in love with Chicago, and then my family's also moved to Chicago recently. So, Rockford is just a couple steps away from there, so it was a perfect place.
Awesome.
Outstanding. And I don't mean any offense by this whatsoever. You sound extremely young. This is, I know that you are absolutely certified and an expert in your field, but you sound like a very young guy, and I would imagine that probably works pretty well for you.
Yeah, thank you. Yes, it does. It makes me feel better that as we all get older, right?
Right. Now I need to have him go, well, I'm 67 years old. I don't know what you're talking about. No, he's not, but nonetheless. Been around this topic. What introduced you to medicine, or what was it that piqued your interest that led you to where you are now?
A lot of things. You see a lot of things on TV that always catches your interest first, as children. And then as we get to, learn more about all these different topics, we find what things are of more interest and what things are not of more interest, right? So, science was always something that interested me. And so it was a perfect kind of transition through high school and college, and then kind of the nature of medicine, helping people, really just kind of was something that really fascinated me and always was exciting for me, and that's kind of what drew me to it.
We've been doing this segment for a bit, and a common thread, and we just talked about it earlier in the show this morning, common thread with a lot of our doctors is it's a family business, or they saw somebody help their family. Are you the first in your family to go to the medical profession?
No, my sister is also a physician, and actually so is my dad, but they weren't really encouraging to do medicine at that time. So
they were. Oh, so wait, did you actually disappoint your family?
They wanted to work on the curveball instead?
Yeah, I think in the end they're okay with it.
I bet they are.
How's your kid doing? Well, got into medicine.
Yeah, he's an interventional neurologist, and we don't know what that is. As a matter of fact, I don't know what it is. You hear neurologist all the time. What is interventional neurology?
Sure, yeah. An interventional neurologist is a neurologist who actually does a lot of procedures to treat stroke and brain aneurysms. So basically, an intervention meaning procedure. We will either go through the artery in the arm, or through the artery in the leg, and we thread catheters all the way up to the brain. And through those catheters, we can treat blockages in our carotid arteries, we can treat aneurysms in the brain, and we can remove blood clots that result from a stroke.
Outstanding. A number of years back, my father-in-law suffered a stroke. Did not make it through that, but I do remember at the time I had I don't know why I had committed to memory the Be Fast acronym. Mm-hmm. Is that still something that you tell people to lock into their memory and work off of it on calling it Be Fast?
Yeah, absolutely, we do. And we like the acronym because it tells you what you kind of need to do, right? You need to be fast when you think you're having a stroke. Because remember, stroke treatments are all very time sensitive. In other words, the clot busting medication, which is the IV TPA, which you get through an IV, you have to have that medicine within you within 4.5 hours, 3 to 4.5 hours, depending on the situation, of your symptom onset. The interventional standpoint of it, where we can go in to remove clots, that's up to 24 hours. But still, as every minute passes that you don't get treatment, that you're not being fast about it, your outcomes are worse. So the acronym Be Fast, B stands for balance, any balance problems in a person that are sudden in onset. Eyes, the E is eyes, basically any visual changes, visual loss, blurry vision. F is face for any facial droop on one side of the face or the other. A is arm weakness or arm drift. S is speech, so any kind of slurred speech or difficulty talking. Some people will say, like during a stroke, they have problems getting their words out. They know what they want to say, but they can't get the words out. So that's also a speech issue. And then T is ultimately saying time to come to the hospital. If you have any or all of those symptoms, this is critical to come to the hospital immediately so that you can receive these time-sensitive, life-changing, and life-saving medications that are now available here locally in Rockford.
Let's talk about strokes in particular right now. Growing up, I always got the three terms kind of confused: stroke, aneurysm, and heart attack. I think when I was growing up, they all kind of meant the same thing to me. How related are those three things to each other? And am I the only one that got confused by that?
No, you're not. It's a very common thing. So basically, I would think a heart attack is basically when you have a blockage in the heart, right? A stroke is typically you have a blockage in an artery in the brain. So I always tell patients or people that, a stroke is a heart attack of the brain. So those are kind of the same sort of entity, different organs, if that makes sense. One's brain, one's heart. And the causes are basically the same, high blood pressure, high cholesterol, diabetes, smoking, and to some extent, genetic risk factors. Now, an aneurysm is a different kind of stroke. It's a bleeding kind of stroke. It's where there's a weakening of the artery or of an artery in the brain. And, and it's the ballooning of it, right? So think about it as when we were all kids, right? We used to blow up balloons and blow them up all the way to the end, and then they like rupture, or they, blow up in our face, right? And we all like that. Or it was fun, at least, maybe for me. Basically, the same sort of thing is what an aneurysm. It's a focal weakening, and it starts to balloon. And over time, with high blood pressure, these stresses on the arteries, they get bigger and bigger and bigger, and then ultimately they just burst. And that's when you hear about somebody who has passed away or somebody has suffered a brain aneurysm. It's a weakening of the artery that then ruptures and blood goes everywhere in the brain. So it's a bleeding kind of stroke.
Famous person who expired from that very thing would be FDR, President Roosevelt in 1945. I believe they attributed his passing to a brain aneurysm.
Oh, interesting. I didn't know that. Yes.
Oh, time out. This is our first time ever where you taught the doctor something on What's Up, Doc?
Well, maybe.
Okay, wow.
Hold on. I'm filling out the certificate right now that says that I have. Now, let's say that this sort of thing is happening not to someone near you, but it is happening to you. When should the determination be made? I should call 911. I should get in the car and get my own butt to the hospital.
So if you feel like you're having a stroke or any of those symptoms, right, you're never wrong to go to the hospital, right? The only time you're going to make a mistake is if you are having a stroke and you don't come to the hospital and get checked out because you've lost that time window. Now, you never want to get into the car yourself and drive to the hospital. You want to call 911. And that's for several reasons. Number one, for your own safety and for the safety of, those other people who are driving. But also, number two, you need to get there quickly, right? You're not going to get there as fast as an ambulance is going to get there and get you triaged and get you, in the appropriate area immediately. So you should come immediately to the hospital.
How far have we come from preventing and treating strokes in the last 5, 10, 20 years?
So that's an excellent question. I'll put it in perspective for you. Up until 2015, all we had was this IV TPA, this clot-busting medication that we get through an IV. So if you have 3 groups of 100 people, if you have one group that got no medicine, no treatment, you have a second group that got this IV medication, and you have this third group of 100 people that now can get an intervention, a surgery for a stroke. So if you got no treatment, only 20 people out of that 100 people would return to their normal life. Okay? Mm-hmm. If you get the clot-busting medication, that number increased by 10. So you would have 30 people out of 100 people who return to their normal life in 90 days. So the IV medication increased your chances of improvement by 10% or by 10 patients per 100. Mm-hmm. With the interventional treatments that we offer now, that number has gone from 30 patients all the way up to now 60 or 70 patients, depending on the study. So you have more than doubled your chances of a good, favorable outcome to resume normal life in 90 days with these new endovascular and interventional treatments for stroke.
And that's astounding.
And when you say new, how new are we talking?
Since 2015.
2015.
It only became standard of care in 2015, so 7 years ago. It's crazy to think about it, right? You know, you think of these medical advancements that have happened, and we think about it as historical, right? We think about like penicillin or the first open heart surgery or all of those things that we think were very remote. They were in like the 40s, 50s, 60s. To think that there are these new treatments that are just as remarkable, that are just being brought to society and brought to the world, it's very like humbling.
And this might be a bigger question than we have time for right now, but what was the advancement to double the expectancy rate out of this?
Sure, no, that's a great question. You know, when you have a blockage in an artery, when you have a stroke, that's a clot in the arterial system. So we have veins that go to the heart, and then we have the arteries that come out of the heart, okay?
Uh-huh.
So you're basically, this IV medication was just giving it medication through a vein to treat an arterial disease, a clot in an artery. So you can imagine that's not any direct route of getting the medication there to kind of treat the problem.
Mm-hmm.
Now what we do is we will actually go in through the artery, right? We go intravascularly into the artery. We see the clot, and we literally pull that clot out. So there's nothing better than actually physically extracting that clot and restoring blood flow to the brain immediately.
And what was preventing us pre-2015 from doing that?
Just the devices.
Okay.
The devices we didn't have, that's one thing. And then also the studies. So, you know, I just finished my training actually in 2014, 2015. So, you know, I was part of those studies where we were doing it even outside of like clinical trials, but it was not like accepted. We needed to have clinical trials that showed, yes, this is beneficial. And once we got those clinical trials like underway, you know, one thing that's very interesting is the FDA actually came and stopped some of these trials early, saying that it's unethical to not give certain patients this treatment. They said it was so effective, we have to stop these trials early, because based off the early effects of these new treatments, it's life-saving, and it would be unethical to just keep on going with trials and not making it standard of care.
And I'm assuming that's rare.
That's very rare, absolutely.
Wow, that's amazing.
Pretty cool.
You know, the one thing I'm going to carry away from this interview is your overall enthusiasm.
Excited.
For what treatments are available and the headway that has been made, the lives that have been saved, the lives that have been improved. I mean, your enthusiasm for this it comes shining through on all of this.
Oh, thank you very much.
Oh, no, thank you. And on behalf of the patients that you'll see and the patients that you'll save and the people whose lives will be made better, no, thank you. That's just outstanding. Dr. Bansal, thanks for taking time out of your day. We appreciate it. This was hyper educational. We learned a lot, and we really appreciate you teaching us.
My pleasure. Anytime.